I'm Laura Haberer. At the Juniper Center, I conduct regular talk therapy as well as ketamine assisted psychotherapy, which we also call CAP. Those are quite different from one another. Regular talk therapy are, sort of what you think of your normal sessions that you book with your therapist to talk about what's going on in your life. Ketamine assisted psychotherapy CAP has a medicine component to that, and it tends to be shorter term. So you would come for psychotherapy sessions prior to and after your medicine sessions that use a therapeutic dose of the medicine ketamine in an effort to create an altered state of consciousness experience for therapeutic purposes. Regular talk therapy doesn't necessarily have an end date. It's client driven, however long you may want to be engaged in therapy. Ketamine assisted psychotherapy is more short term in that you have your preparation sessions, you'll have medicine sessions, what we call integration psychotherapy sessions, and then after probably on average 3 to 5 medicine sessions, you would return back to perhaps your regular talk therapist or mental health providers for any ongoing support. When you come for a medicine session, you'll come to our office in Chicago and you'll meet with me as your CAP therapist and also the prescriber who will be administering the medicine. You'll have your vitals checked. You'll come into the office, sort of make yourself comfortable. And then after a few minutes of setting yourself up and sort of letting the previous part of your day fall away and be ready for this session, you would be administered your medicine either intravenously or intramuscularly. And then I would be with you the whole time. It's about a 2-hour session. You can expect that your actual experience of being under the influence of the medicine to be about 30 to 90 minutes. And then we sort of have that time on either end just to set yourself up and then make sure that you're sort of back to yourself and feeling pretty good before you would leave the office. Your ketamine will be administered by one of our prescribers, so either our nurse practitioner or our psychiatrist. They would also be walking you through, prior to any medicine sessions, medical clearance, just to rule out any contraindications and make sure that physically your body is able to take in this medicine. So after your experience, of which, like I said, I would be with you the whole time, you would be checked by the prescriber, check your vitals again, just make sure that you're okay. We talk briefly about aftercare just to set yourself up for good self-care in the hours following and into that day and the next 24 hours. And you would already have an integration psychotherapy session booked with me prior to your next medicine session. Integration psychotherapy sessions take place in between each medicine session. So you would either meet with me via telehealth or come into my office for a regular 1-hour block of therapy where we would really debrief and sort through that experience. We might talk about any challenges you experienced during the medicine session, any insights that you may have gained or really want to tease out, and then also how do we integrate what you may have learned about yourself or your experiences into your life? Because at the end of the day, you'll be walking back into your life. And we want to set you up to be able to create meaningful and lasting change that really allows you to move into your life with wholeness and wellness. No 2 medicine sessions will look the same, and even 2 medicine sessions experienced by the same person will necessarily look the same. So that means that integration sessions can always look different from one another, but the objective is to really help you make sense of and make meaning out of the experience so that you can walk back into your life and really live your true authentic self. You may be considering this type of treatment if you have treatment-resistant depression, severe anxiety, maybe PTSD, or obsessive compulsive disorder, and you have tried everything else that's out there. Oftentimes we see that people have been in therapy for a long time, years even, or tried every medication that their psychiatrist has been able to offer them and haven't really experienced the type of relief that they're after. If anything, sort of just some symptom relief sometimes. So this type of treatment is really for you if you've tried everything else and you're really looking to engage in deep personal healing. Ketamine has actually been available for mental health purposes for quite some time, a number of years it's been used, but most often the way you may have come across it is described as ketamine therapy, as opposed to what we're offering, which is ketamine assisted psychotherapy. And the difference there being that somebody who might engage in ketamine therapy, that experience looks like going to a psychiatrist or another prescriber's office. You've been medically cleared by them for ketamine administration. You're left in a room, administered the ketamine, and sort of there by yourself to experience your journey. And then there's no therapy aspect involved. You'll be sort of checked in on and cleared to make sure that you're physically okay to go home. But other than that, there's no therapy involved. And what we see is that people do experience symptom relief. It hasn't like an antidepressant effect, but it's not long lasting, much like a lot of the other medications that people have tried. Ketamine assisted psychotherapy is very different because we have this rather large therapy component combined with the medicine sessions. So there are at least 3 preparation sessions before any medicine is actually administered, and then integration sessions that take place in between each medicine session. Because what we've found is that with the combination of the psychotherapy, that's where people can really make meaningful and lasting changes for the long term. Sometimes people can even fundamentally change their core belief or value systems. And really, what we're after is deep personal growth as opposed to temporary symptom relief. This is quite a different type of treatment than anything else that you may have tried before. And what we really hope for people to achieve is really deep personal growth.